Stroke can be very, very debilitating. When a family member or a loved one has stroke in the family, the person loses their ability to take care of themselves. And because of that, all the loved ones around them also suffer. So on this video, we're going to talk about some of the ways that we can prevent stroke. Of course, this is not 100%, but if we learn how to reduce these risk factors, our chances or your chance of having a stroke become very, very less. In fact, the American Heart Association or the Stroke Foundation have actually listed some of these things that anybody can do to reduce your chances of having a stroke. The first one is if you have high blood pressure, you want to control your blood pressure. In fact, high blood pressure is a silent killer. In fact, most of the time, people do not even know they have it. So that is why it's so important to check your blood pressure at least once a week. If you don't have a blood pressure cuff, you live in the Western world, you can go and purchase one. It's not very expensive. If I can get one on Amazon or any of the stores. Now, if you not watch my videos on how to reduce your blood pressure in a natural way, go to the channel and watch that video. So if you already have high blood pressure and you're not able to control the blood pressure, you can watch those videos and that's going to help you to lower your numbers. In fact, the numbers you want to reach is that your top number should be less than 140 and your lower number should be less than 90. The American Heart Association tells you to get your blood pressure less than 120, the top number, and less than 80, the bottom number. But the American Academy of Family Physician actually tells you that if the lower number is less than 140, the upper number is less than 140, and the lower number is less than 90, you are actually controlling your blood pressure. That's number one factor. The second factor is diabetes. Most of the people with diabetes have type 2 diabetes, which actually is a lifestyle disease. So by doing certain lifestyle changes, you can be able to control that blood sugar. And the numbers you are aiming at is to get your hemoglobin A1C to be 7 or less. That is your average blood sugar checked over a period of 3 months. So by lifestyle changes, which by that I mean exercising, your diet, mostly if you stick to low carb diet, you'll be able to maintain a very, very good blood sugar. Because when you have diabetes, you have a higher chance of having a stroke than a person who does not have diabetes. So it's very important that you learn to control your blood sugar. The third and the most important one is management of stress. This is something that people don't talk about. Stress is a very number one killer. Stress can kill you. Stress can lead to stroke and heart attack. Stress can lead to many, many diseases. So it's very important that you learn how to manage your stress. Now, recently, there's a gentleman about 75 years old. He was healthy, just walking around and doing his own things. But he had a bad news that his son was crashed in an accident. And immediately, he could not manage the stress. He had a stroke, which became very debilitating. So it's important that you and I learn how to manage stress, because that alone can be a source of you having a stroke versus a heart attack. So it's very important that we learn how to manage stress. The next thing is if you're a smoker or you drink alcohol excessively, you want to stop that, because these are high risk factors that can prone you to having a stroke. Especially if you're a smoker, you want to quit that smoking, because it's a very bad habit for you and it can lead to a stroke or a heart attack. The last but not the least is exercising and diet, which I just talked about. Now, by exercise, I mean doing aerobic exercises that you can maintain even when you are 90 years old. And I think walking is one of them that everybody can walk. So don't be a couch potato. Get out of the couch and do some walking every day, or at least 5 times in a week. By doing that, it helps reduce your chances of having a stroke or a heart attack. Now, if you have certain special conditions like atrial fibrillation, what is that? It is an irregular heartbeat that have a high chance of having a stroke. And so if you check your pulse and note that your pulse, you are skipping beats and it's irregular, and you haven't seen a doctor, it's very important that you go in to see a doctor and get an EKG. But sometimes people have atrial fibrillation, this arrhythmia, and they not feel it at all. Some people may feel it. They may have palpitations, so they'll go see the doctor. But most people do not feel this, and so they don't know whether they have this disease or not. So it's very important that you do a once a year medical checkup to see what your heart condition is. If you have atrial fibrillation, some people may end up being on anticoagulation, that's a blood thinner, to help prevent stroke. Or if you have a special condition, you feel dizzy all the time, sometimes you may have a condition called carotid artery stenosis. That is the artery that is around your neck that goes to your brain, narrowed. And sometimes you may not know, but all your symptoms may be, you have maybe a noise in your head or in your ears, a very loud noise, or you feel dizzy all the time. You don't want to ignore those signs. Go in and get checked, because it's possible that you have what we call carotid artery stenosis. And usually if you have that, you can see a neurosurgeon and they'll be able to put a stent in, and that to reduce your chances of having a stroke. So these are just some of the things I just mentioned that you and I can do to prevent stroke. So if you have any of these conditions, make sure that you bring them under control. This will not completely eliminate you from getting a stroke, but it will reduce your chance significantly of getting a stroke. Last but not the least, if you don't know what the signs of a stroke is, go back to my video on the channel, and I have a video there that outlines some of the signs of a stroke, so you and I can take care of ourselves. Like I always say, in the 21st century, you and I are your own doctor, because you know your body more than any physician. So take care of yourself so that you and your loved ones can enjoy your health. Until then, I'll see you again. If you haven't subscribed to my channel, I want you to hit the subscribe button or share this information with your friends so that families can live without a stroke.